Hi, it's Evan Kirstel here with eViRa Health out of Boston. Delighted to chat with a couple of fascinating people today. Firstly, Irma Rastegayeva of eViRa Health. Hi, Irma.
Hi, Evan. Hi, Tim.
And our guest of honor is Tim Washburn, Chief Clinical Officer at Electronic Caregiver. Tim is, among many other distinguished things, a nurse of 25 years, a nursing leader, and a leader at Electronic Caregiver.
Good to see you. Thanks for having me.
How is Electronic Caregiver helping communities, including employers and municipalities, to safely reopen in this country and around the world?
Sure. So, a couple of things about COVID. First, we're learning more about it every day, right? So the science around what it is, what it isn't, how you look for it, who has it, that changes every day. But some things haven't changed. Basic good infection control practices, they've been the same for hundreds of years. So one of the ways we're helping with that is our equipment has the ability, depending on the type of equipment, for example, to take a temperature. Well, if I take a temperature, that's a data point. That doesn't necessarily mean anything. I can have a fever because I have allergies, because I have strep throat, because I have, fill it in, right? So we use our technology to leverage data with certain screening protocols, and we're going to be doing our first with a local university, large scale, about 100 folks, where we're leveraging this with our Premier device so that we can actually get a handle before that employee or student leaves home. Are they at risk? Do they have a fever? Are they not feeling well? We use the CDC questions, for example, as a survey. Get those questions answered right through the device. Turn that voice data into what we call discrete data, which allows us to then alert whoever you want to, whether it's a doctor, whether it's the HR specialist, whether it's a supervisor. But the idea is let's what we call pre-screen while they're at home. Let's see if there is an issue potentially. Then let's have them talk to somebody. And if they need medical care, let's have them get on the phone with the doctor through our telemedicine platform. We do all of that through the same device. So we're going to be releasing that, again, we think this week or early next week with a university. We're also developing a specific web app, and we're working with the Austrian Football League, the soccer league. If you're an American, I don't mean American football, I mean European soccer. But working with them on a couple of different apps. So the idea is we're looking at the continuum of care saying, we're going to have 3 or 4 different ways we can help. It might be an app, might be used by students. We're going to be hopefully working with some high schools and school districts. And if you're listening and you want to know how can I affordably actually have some way to manage these kids before they show up at school sick, call me. We have a way to do it. We're working with the sports teams to say, okay, if we want to understand contact tracing, but not the contact tracing everybody's heard of that everybody's scared of, where literally every step you take, Big Brother knows, because a lot of people don't like that, just saying. It'll be like that, but take all that data, merge it, and eventually, if you're someone managing a population, you'll actually be able to see some of this data across the dashboard and see what are they reporting and really manage that better. The ultimate goal, and we have an even bigger plan, it goes all the way through to having a way to scan into a business and use an ID to track who went where in what business. So as business is open, if we do have an unfortunate outbreak, we can very quickly, like that, say, okay, Irma and Evan and Tim were just in that store. We need to call them. So that's a little bit future facing, but you get the concept. Let's turn this from let's be afraid of everything to let's acknowledge we have to open our country, because at the end of the day, if we're all starving to death, COVID isn't the biggest problem, right? We're hungry. And let's instead be very intelligent and make this nuanced approach. You're obviously picking up the theme. We don't want one solution fits all because we know it doesn't work. We're going to have several. And even within each of those solutions, we have the ability to tailor them. And that really is our focus. So we're working with a lot of different organizations. We're working with the WHO, the World Health Organization. We're going to be going to Germany in November. We have a whole big project going on them with Addison, the virtual caregiver. We're doing a lot of different things. I could spend a whole day talking to you about all of them, but